hello everyone. We are aware of the fact that at this moment, the disease that is causing a lot of concern among all of us is dengue fever. So I'm going to tell you what are the usual symptoms, the way of diagnosing it, and how we should go about it as far as the management is concerned. So dengue fever, as we all know, is a viral fever. So the usual symptoms is that it starts with very high grade fever that can range to the range of around 102, 3, 4, even go up to 5 and 6 for the initial first 5 to 6 days of the fever. We have to remember the dengue fever is also known as breakbone fever. So it causes a lot of body ache, it causes tremendous headache, it causes pain behind your eyes and a lot of lethargy. The patients usually get extremely weak. They often complain that we are not even being able to get up from the bed. So these are the usual symptoms of dengue which persist for the first 3 to 4 days, that is fever, body ache and headache. Following that, the patients might develop a rash, which is very common in dengue because it is one of the fevers that causes rash. The next 5 days, that is the day around from the 5th day to the 9th day, are the main periods of observation when we have to be very vigilant on the patient, because patients who usually experience a platelet drop have their platelets down during this afebrile phase of the disease. So how do we go about the diagnosis? Regarding the diagnosis, usually within the first 2 days, we send a complete blood count. We try to look at the total leukocyte count and the baseline platelet values of the patient, along with a value called the PCV or the HCT, that is the hematocrit, which tells us about the blood thickness. So this is one of the values which we are really concerned about. Apart from that, we try to send the dengue NS1 antigen, which is usually positive within the first 2 days. After 5 days of fever, we send something which we call the dengue IgM test. So beyond the 5th day, the IgM usually comes out to be positive and is quite specific for the disease. If any patient is having a tendency of having low platelets, we usually try to repeat the CBC every 48 hours, try to see the trend of the WBC count, of the hematocrit and also of the platelets. We are not supposed to be unnecessarily panicky about the platelet count because of the fact that platelets usually on a natural course go down on dengue. So which are the situations which we are supposed to be bothered about? One, if there is a dramatic drop down in platelets, suppose a patient having a platelet count today of 2 lakh suddenly drop down to around 80,000 tomorrow, we are a bit concerned. If the platelet counts are less than 1 lakh, we try to send platelets 12 hourly and concentrate on not only the values but also the clinical features. We deal with the fever as we usually do: paracetamol, tepid sponging and regular temperature monitoring. We ask the patient to keep themselves hydrated, usually 1 liter more fluid intake than what they usually have, around 2 to 3 liters a day. So what are the indications of hospitalization? 1, if there is high grade fever persisting beyond the 5th day, if the patient is severely dehydrated and extremely weak that they cannot even sustain themselves, are bedridden, the patient is having too much of loose motions and too much of nausea, vomiting, because of which the patient cannot take adequate amount of fluids, the patient is having tremendous abdominal pain, low urine output or any bleeding symptoms in the form of rashes on the skin, patches on the skin or bleeding through urine or other orifices. Whenever such symptoms appear, then the patient is advised to get hospitalized. So these are the basic symptoms, these are the basic management in cases of dengue. The most important message goes: do not panic, contact your doctor whenever it is necessary. Predominantly do not take decisions on yourself, depend on healthcare facilities, and whenever hospitalization is required, do not hesitate. CMRI Hospital is always there to help you out in every crisis situation.